Welcome to North Star Physical Therapy Podcast. I'm Dr. Shirlea North, and with over a decade of clinical expertise in the areas of pelvic floor conditions, lymphatic conditions, and chronic neurological diseases, I have a wealth of medical knowledge that I want to share with you all. In this podcast, I will answer the most common questions I receive from clients, family members, and fellow clinicians. Our purpose is not only to answer questions, but to educate you so you can make the best decision for your optimal health. This podcast is perfect to listen on your way home from work, while you're on your daily walk, or just taking 15 to 20 minutes for yourself. Again, welcome to North Star Physical Therapy Podcast, and get ready for us to guide you to optimal health. All right. Hello. Welcome back to North Star Physical Therapy Podcast. And thank you for all those that are coming back. And for those that are new, this is a very exciting episode for us this time around. We have a beautiful guest, Meghan Robinson from Hearth and Home Therapy. And so she is a sex therapist. And that is always something that kind of gets confused out there in the ether with pelvic health physical therapy and sex therapy. And there's sexologists and there's all sorts of little like nuances to things. So I wanted to bring Meghan on as our guest today to help, number one, like explain like her, intro herself and give us a little snapshot of what the heck sex therapy is, what to expect, what does she do, how do we collaborate together with the more like physical piece of like pelvic health and getting into the mental behavioral piece and how that all comes together. So without kind of further ado, we're just going to kind of hop in it because, I mean, if y'all have listened to any of my podcasts, you know that's what I do. So, Meghan, hey.
Hello. Hi. Yeah, thank you for having me on. I'm very excited to talk about the overlap and maybe hopefully like break down some myths and just make this idea of sex therapy and in our pelvic floor like more accessible, less scary. So
100%. Everybody's got a pelvis.
Yes.
Everybody's got a pelvis. Everybody has a nervous system. Everybody's got a brain. Like we all need to make sure we're working together, especially in these crazy times.
Yes.
So Meghan, your company is Hearth and Home Therapy, right? So tell me, how did you think of that name? It's such a very unique name.
Yeah, I was working at a group therapy practice. Mm-hmm. And then about 2 years ago, I was like, I'm going to go out and take the risk and do this on my own. And while I was thinking about, it's such a big decision coming up with a name for your business. And the therapy I do and the work that is really important to me is really this sentiment of like coming home to ourselves, coming home, feeling at home in ourselves, in our bodies, in our relationships. And when I was sitting with that saying, and I might butcher it, but it's something about like coming back to Hearth and Home or something like that like that is the place where we congregate and have community and come back together. And so it felt like it fit.
That's awesome. Yeah, because everybody's like, oh, home is where the heart is, and kitchen is the heart of the home. And all. But when you think of like, okay, if you're there like on a Friday night, you're just hanging out, watching a movie, and there's like the fireplace or like family gatherings or, for holidays or something, it's typically around like a hearth, around a fire, So I think that's so symbolic. That's so cool.
Yeah. Thank you. Yeah.
Oh, yeah.
I'm a fan.
I just have to keep adding that H to hearth, right?
Yes. I always emphasize it because it's easy to drop in.
So explain to me, what is sex therapy? I know that's like a very general, basic question, but I'm sure you get it all the time. I get it all the time with like, what's the difference between physical and occupational therapy? Like a very general thing, but what is sex therapy? Just in general, and then like what do people expect in a session like that with a sex therapist just to kind of help normalize that piece of your profession.
Yeah, absolutely. Sex therapy isn't too different than regular talk therapy.
Mm-hmm.
It just is focused on different sexual concerns or struggles that somebody is having. So the big question I get, or the thing that I immediately like to say, is like, sex therapy does not mean that there's any sexual touch or touch happening in a therapy session.
Yes.
We are talking. Um, the way I work, I use the body and somatic approaches to help my clients get more in tune with,
Mm.
as we're talking about these sexual issues, like what's going on in your body, right? Like
Mm.
where are you feeling that? Is there tension that you're holding?
Mm.
And so just putting that disclaimer out there right at the
Yeah.
start. In terms of like the different things that bring people to sex therapy, it's it's a big bucket. um,
Mm-hmm.
the big ones, anything to do with desire, arousal, pleasure. Most commonly, like when somebody isn't feeling any desire,
Mm.
or there's that desire discrepancy happening in a relationship, and it's mixed and it's causing some friction and conflict between the partners. It's and I love doing this work, sexual identity and orientation exploration.
Mm. Mm-hmm.
Right? There's a lot of people don't have a safe space to explore that. And so coming to therapy can be the first time that we do that. And uh, even with that identity work, there's so much body work in that too, right? Like, are we,
Mm-hmm.
how safe does it feel to be in our own bodies? Are we experiencing any dysphoria if we're going through gender affirming care, right? Getting used
Mm-hmm.
to a new body, new to us body, even if it's one that we've longed for, can still
Yeah.
bring up a lot. Um, so yeah, that's kind of the
So
place
many
I love to
things.
live. But yeah, other,
Yeah.
just quick other things, sexual function pieces. So concerns with orgasm, premature ejaculation, difficulty maintaining an erection, trauma, sexual
Mm-hmm.
trauma. That's another big piece that I work in. Body image stuff I already touched upon, but those are kind of like the
Yeah.
big pieces.
And they're huge pieces, my goodness.
Yeah,
Like
they're
it's
big.
like,
Yeah,
whew.
yeah, yeah.
And I mean, and so it's so nice because, as a lot of folks know, like on this podcast, too, like I'm also a very inclusive therapist as well within the physical therapy realm. So that, yeah, gender affirming care, or also just like treating those that who, identify as men, too, because female, identifying therapists aren't comfortable with male. So that's wonderful that you treat the whole gamut, just like myself.
Yes.
It's like
Yeah.
everybody
Yeah.
needs help here.
Yeah.
So
Everybody is a sexual being. It's a part of us. So yeah, that's,
so nice.
yeah.
Oh, that's so nice here. So when you are going like through, so it seems like that, yeah, like sex therapy is that more, it's that more individualized kind of like one-on-one, really like the mental behavioral health like realm of it, and how your body is maybe like, yeah, you're trying to like have them become more like aware of like what's going on in
Mm-hmm.
their body a little bit because of trauma, or
Yep.
they're trying to
Yep.
connect in their like newer identity that they're
Mm-hmm.
um
Mm-hmm. Yep.
transitioning to, whether that's a transgender
Yes.
or just
Yeah.
being or
Yeah.
like
Just
pleasure.
being,
Yeah.
yeah, connecting to their pleasure. I mean, as adults, I feel like we get so far away from that.
Yes.
Sex is a way that we play as adults. We're so good at it as kids, and life happens to us, and we just get busy and we forget how to play. And so that's
And we're
another
like
reason
that.
I
It's like
love
a
I
little
love
sandbox.
this.
It's like a
Yeah,
little
it
adult
is a little
sandbox.
sandbox. Yeah. To just get in and play, figure out what, yeah, brings that joy and that pleasure back into our lives. So,
Yeah, because and that's where sometimes when I'm talking to like my folks, like of asking them more of the physical, like screening questions of like, is there any pain with penetration or intercourse? And sometimes I get this little hesitant, like either they don't want to say anything,
yeah,
or they're like, ugh. And it's like it's okay if you're not, like there
yeah,
are other things um, that for example, if someone has a vagina, it's like it isn't just like yes all about sex, it's we have to also like have like pap smears and like
yeah,
if they're still menstruating, are they using a
yeah,
tampon or some sort of insertable device? So it's like there's other like more
yes,
physical things that I'm going down and inquiring about that, the musculoskeletal aspect.
yes,
We have to respect of like, yeah, if someone's coming in with a potential trauma or something. And so let's kind of speak a little bit about how we would like collaborate. So if you can maybe recall if there's like a certain client, or give us an example of like if you start seeing somebody and you were talking about like getting into that awareness and into that body work a little bit, what would be like a good indicator to you to potentially like refer to someone, like myself, a pelvic floor PT?
yeah, yeah. That's a great question. So, one of the things that I screen everyone for is, do they experience any sort of pelvic pain?
Mhm.
Um, Are they, if they're a penis owner, is there any erectile difficulties? Um, and if there is, I just have a conversation with them about, have you ever brought this up to um, your doctor? Have you ever
Mhm.
done physical therapy to even just like assess if they're, you know, if that is an avenue to help release some of
Mhm.
this pain that you're feeling. Um, if and so we kind of go from there. If they
Mhm.
haven't, I give a little referral and say, hey,
Mhm.
let's rule this out. If
Right.
there's nothing there, and if there is, that is so important, because if we don't address, right, the physical muscular,
Mhm.
that piece that you are way more well versed in than I am, the ins and outs of that, right? If we just if we ignore that and just do therapy, it could get worse.
Mhm.
And I don't want that. Right.
Right.
Um, so I think, did I answer?
Yeah, yeah. And I think it's like, and it's so interesting because even in like the same token, so even like in reverse. So if I had somebody who you had that example of someone who's a penis owner that has penile pain or like erectile dysfunction, and you were asking if there was any pain associated with that, cool. Let's refer to Dr. North. They come in and see me, and we're looking at the musculoskeletal things. We're looking at outside the pelvis. We're looking at is there any contributing factors from their low back, from their
Yep.
abdominals, um, looking at the pelvic floor musculature like itself. But then if I'm going through and we're kind of like checking off the boxes and like there isn't really, or there's no like scars maybe along their abdomen that's creating fascial tension, like there's
Yeah.
nothing really physically that I'm seeing. And then we're also, it's like, okay, have you, are you in a very like what are any external stressors? It's kind of like
Yep.
my like little phrase to kind of screen out for like your services of like work,
Yep.
familial,
Yep.
financial, relationship.
Yep.
We kind of sit down like your lifestyle because we know vagus nerve, right? So that's like the big like nervous system down
Yep.
training, but the vagus nerve is the powerhouse of the parasympathetic nervous system. And I'm talking about their sleep, as well. How's your sleep hygiene? And so we kind of
Yep.
get into a little bit of like nitty gritty. A lot of like that session, um, is a bit of a like come to Jesus moment for a lot of people. It's a bit of a light bulb moment for a lot of people.
Yeah,
Sometimes
absolutely.
it's a bit of like hitting a brick wall for me if I'm saying all these things and you can just read people, and if there's a bit of a hesitancy, it's like, look, my scope is to like look at the musculoskeletal system, factor in what the nervous system is doing to kind of guard maybe that area. Maybe that's why we're having some pain.
Yeah.
We may need to rule out some vascularity stuff, especially for erectile dysfunction. So I might, say, hey, we may need to rule out maybe some things we're getting another, professional involved, but I can't disregard what the nervous system does and the body keeps the score. So we might
Yes.
have this like diffuse, like it's almost like this quote unquote visceral pain, even though that's
Yeah.
not like, I think like visceral organs do not have pain. It's like how the spinal nerves and everything. That's all the
Mhm.
like, neuroscience stuff. But we
Yeah.
do educate a little bit of neuroscience and how
Yes.
our nervous system goes. So we do a lot of education, but I'm like, and to that end, it is beyond my scope of practice to get into like that nitty gritty of what you need with that,
Yeah.
with
Yeah. I mean,
psychosocial somatic thing.
there's so much education that it sounds like we both do on
Mhm.
different ends. And that's
Yeah.
another such important piece of being able to work together and collaborate is just like, you know, two minds is better than one, right? And especially when we have our own areas of expertise. And
Yeah.
if I can add a little bit of like on my end, other things that I'm assessing for that I'm also picking up on that, like, okay, I think there is maybe something more kind of emotional happening here that could be related to the pain or discomfort is, is there, um, you know, is this happening all the time? Right? Or is
Mm-hmm.
this just happening? Are you only experiencing that pain, tension, discomfort, however they're describing it, in certain moments or with certain people? To me, that's
Mm-hmm.
a big indicator.
Mm-hmm.
If you're a vulva owner, right, and you're inserting something into your vagina, and every single time, whether it's, I don't know, a penis or a toy or a tampon or right,
Mm-hmm.
and it hurts consistently, that is a big flag for me. Like, okay, we're definitely go talk to a pelvic floor therapist. You're
That's a
telling
great,
me,
yeah,
yeah, it's
that's a good
only
question.
happening like in this relationship with this person. Okay, now I'm going, okay, what's going on in the relationship there?
Yeah.
Right. And, what do we have to talk about and support you with there? Because if we're
Yeah.
tensing up during sex with just that person, yeah, it's
Yeah.
gonna,
It's not going to be fun. Yeah.
no, it's not.
Right. But I like that too, because yeah, whenever we're kind of talking about sex, it is definitely multifactorial, and I say I'm like we're gonna get a little bit like mechanical, with stuff of like just understanding angles. And I always tell everybody my role is not to tell you exactly what position you should be doing, right? It's we want you to make sure like you can have pain-free sex however position like you want to be in and not be in fear of or not restrict yourself
Yes.
because physically it hurts, right? Or not to like suck it up either because you're just trying to get pregnant or you're sucking it up
Yeah.
because of your partner or something. So like I try to like keep that in the back like of our mind, but okay, we're gonna get a little mechanical here, right? And so we're teaching them like pelvic angles and within different positions, how the angle is, how they can adjust that, how our legs are supported, how our arms supported, educating the normal CEO lube use, and like that kind of more like physical, like nitty gritty stuff. Um, and then it's like, and then can you, and I always ask this too to people, like, can you communicate that to your partner? Or do you have like a code word? Or how open is that conversation?
Yes.
If there's any kind
Yes.
of hesitancy, I'm like, off to
Yep.
Megan now.
Yep.
Because it's like a relationship thing. Um, I kid around sometimes too. Like I have a doctor in physical therapy. I have a minor in psychology. If I start using like my minor in psych a little bit more than my doctor in PT, I'm like, okay, we got like, this is beyond my scope. I gotta get Meghan.
Yes. Yes. Yeah. And so I love the way that you're organizing that, because similar, right? If my conversations with a client keep coming back to more of this like physical component that isn't budging as we're talking through all of these other factors, like, all right, let's go see Dr. North. Right? Yeah, this is I'll get it a little bit outside of where I can be.
It's okay that we say that, and that's why
Yes.
also important
Yes.
when people are listening to this episode too. It's like, there are things that are yes, like outside of our licensure and stuff, but it's like, yeah, but this is why we network and connect, so that when they can be a
Yes.
part, they can have their village be building. And so that's one thing we really want to deploy with this podcast, is that there's many of us coming from different angles, like you mentioned, to like the same common goal of pain-free, fun sex, for this example, that it's in, a great relationship, or whatever that may look like, too, like there's non-judgment. So that there can be many providers a part of your village, not you trying to fit into ours. And so, yeah, so somebody may be, I kind of think of like those little fun, like, are those, what are they called? Pictographs or something, where there's like the center is like,
Yes.
that's our client. And then there's the little like lines for like many people. So yeah, we're complex beings.
Yes.
And one person isn't going to solve all of it. Just like your primary care refers you to different specialists, like we are the specialists that refer to each other too, because you're more than just your genitalia.
Yes. Yeah. Yeah. Absolutely.
And to help normalize that conversation. And so Meghan, with your practice, what are some things that kind of set you apart in terms of like having people being able to like connect in that, the hearth of the home, right? So it's like that warmth and that comfortability. I mean, the fact that you're a very inclusive therapist is awesome. So you treat everybody, in the gamut there. But I'm sure with these kind of more sensitive conversations, like, yes, there's that innate nature, of us to like just help in our personality. But I think you do virtual sessions. So I imagine that helps people be like in the comfort of their own home, and talking about these things too.
Sometimes, though, and I do see clients in person. I have an office in Herndon. A lot of, not everyone I see comes to see me for sex therapy. I have noticed that a lot of my sex therapy clients do prefer coming in person if they're able to.
Interesting. Okay.
Yeah, it is really interesting. And so I don't know. My best guess is, there's, in some instances, it might be there's more privacy, right? No one's going to overhear, because people feel a lot of anxiety, shame, discomfort talking about sex. Makes sense. We do a really terrible job talking about sex and educating about sex, and that it's okay and it's just a part of who we are. So some of it might be that, some of it might be, just kind of getting away from the hustle and bustle and being able to come into a really calm space where they don't have to think about anything else. So interesting tangent.
No, that is interesting. Yeah, you kind of seem like, oh yeah, virtual, but that's a very good point. And then it's great that you have options like that too. You have that option. I'm gonna do that too, just for the sake of like, if there's a convenience thing, or like cars in the shop, or the kid is sick, like I want you to keep getting your treatment and everything, whatever works for you. So we offer virtual sessions as well if they're too far away, or something like that. So it's nice that you have both, and I can totally get that. It's like going to the gym, right? It's like there are people that have like the home gym and they love that convenience, and like that's what works for them. But some people just need to leave their home, or they're just going to be lazy little couch potatoes. So that's interesting that like for you to, and I find like a lot of therapy places are like the most warm and inviting places ever. Like comfy couch or a chair, like just homey. It's in your name of your business, I'm sure. Like your office.
Yes.
Is definitely that.
Yes. Yeah. Yeah, am I often? I'll brag a little bit. I just moved into a new office space. It's all mine. I got to decorate it. I went homey, so I want to live there. I look forward to going in and just like laying on my couch if I have a break.
Right.
So yeah, I,
That's what
you
I tell
know,
people too. They come in my office, I'm like, put your stuff wherever. I'm like, this is like
yeah,
my second home. Like, just
yeah,
wherever.
make it your home.
Yes. Oh, well, that's so awesome. And that's when, like, when we, share a client and collaborate, it's nice that they're kind of going to similar environments, they're going to similar,
Yeah,
like-minded professionals. And that's really what you want to find to be within your village of those like-minded professionals, that they're not like, we're not territorial, we're not competing, we're coming from two separate, sides
yeah,
going, I
yep,
kind of think of like like Lady the Tramp moment, like with the spaghetti, right? Like the middle is like where we want you to be, and
yes,
this is
yep,
how we're getting there. Um, and when I'm like, I love when I'm working with somebody, I'm not saying like, hey, we're going to stop here for you to go see Megan, work on your shit, and then come back. It's like, no, we want to be integrated so that if there's
yes,
something that I'm noticing here, or if I'm doing some kind of maybe manual work, or we're doing some like vagus nerve stimulation to try
yeah,
to like tap into that parasympathetic nervous system a little bit, see how our body responds, we can say, hey, I'm going to let Megan know, what
yeah,
feedback, from that, or like,
yes.
hey, this worked, or this was mentioned, not like that we're tattling, but like, and
No,
because
but yeah, to
it's just,
just keep everybody on the same page.
yeah,
Sorry, I just
totally.
like jumped in right over you.
That's great. Yeah,
But
or like, or if you have like, if you guys are working on any like a visualization or a mantra, and there's something that
yes,
works, it's like,
yeah,
I want to know that so we can tie it into the physical piece. If
yes,
we're working on
yeah,
like breath
yeah,
work, or if there's
yeah,
something physical that we're doing, how can we connect those two worlds so we aren't being so silo in
yeah,
our body, because that's just not how it works.
yeah, yeah, absolutely. And on my end, what I run into often, right, is that there's sex and bodies, people are really uncomfortable with that. Right?
Mhm.
And to be going into a space where may be interacting with their body, if they have trauma, if they've had, um, whether it's sexual trauma or even just in the medical field, I run into that a lot
Mhm.
of just people being really nervous and anxious about going to see um, a medical provider. And so sometimes that's what I'm helping people process, right?
Mhm.
And that is so important for you to know of like, hey, right?
Right.
This could be activating for this particular person. This is some of the
Right.
things that, we talked about and, what we came up with to support them when they're coming to see you, and just wanted to make you aware. So that's some of what it looks like on my end.
That's wonderful. Yeah, because we don't want to continue that
Right.
the cycle like at all, and so we're all in it together, and um, so I hope this helps kind of shed some light. So this is just a very like kind of basic like 101.
Yes.
What sex
Yep.
therapy? What is it about? What to expect, and then also just more specifically, Megan, plug away. Tell us how
Yeah.
to like get in touch with you at Hearth and Home Therapy.
Yeah, absolutely. So, yeah, my business is Hearth and Home Therapy. It's just me there at the moment. Um, you can get in touch. I'm not currently on social media anywhere. I'm working on it. I haven't like taken that leap yet.
We'll pull her
Um,
in, guys. We'll pull her in. No, I'm just
yeah.
teasing.
So unfortunately, you can't find me on Instagram or Facebook or anything like that. But you can find my website at hearthandhometherapy.com. You can reach out to me at info@hearthandhometherapy.com.
Perfect, perfect. Well, thank you, Megan, so much for joining me today. And I think this was
Thank you
really
for
helpful
having me.
to see the fun little Venn diagram of like pelvic health PT, sexual therapy, and where we kind of meet in the middle in that little
Yeah.
section. And that is our clients. We're all from the same
Yes.
thing. So thank you so much for shedding light and normalizing like sex therapy is a very, very specialized like mental behavioral health therapy, but it is very individualized and it does work and collaborate with other providers. And I think that's just so wonderful. And it's just wonderful that to have a fellow like inclusive therapist as well, because there's not enough of us out there, and we need you.
Yes, we do. We need you. We need each other.
Awesome. Well, thank you so much. And for everybody
Thank
listening, until next time. Thank you all so much for listening to North Star Physical Therapy Podcast. Continue to follow me on Facebook or Instagram at Dr. Shirlea North. Check out my website at www.northstardpt.com, or I encourage you to email me any other questions about these topics, and it can be featured at a future podcast at snorth@northstardpt.com. Again, thank you all so much, and thank you for letting North Star Physical Therapy be your guiding light to your optimal health.